Well, first of all, you have to start off with the great first impression. When you walk into a room, you have to smile.
Come in.
Hi, Mrs. Brown. How are you?
I'm good.
So good to see you today. Doing well. Welcome to the office again. So I feel like, when you smile, you're friendly, you shake the person's hand. It really makes the patient at ease. It really makes them comfortable. In addition, patients also like for you to get to know them. If you joke around with them, you ask about their family, you ask about maybe something that's important to them, or you write down in the chart the name of their family pet.
Something so simple as trying to get to their level, looking in their eye, and even if you're able to show that you can sit for a little bit, even if you still are pressed for time, it gives the appearance that you're not, and that time that you're with them is really important. First of all, I'm your supervising physician here within internal medicine, and I see that you see Dr. Miller. Mm-hmm. So I do see Dr. Miller's patients when they're admitted to the hospital here. How was your night last night?
What patients worry about, although they want to be in the hospital, they want their problems managed, the most common thing that they're worried about is how long do I have to be here and when can I go home, which is understandable. So what I'm always trying to let patients know is that I'm anticipating that I'm trying to get them home or to the next appropriate setting.
So having them to know you're not in the exam room where you've been forgotten about. I still know that you're here and I'm coming to see you, and knowing how long that they have to wait, I think helps to put them at ease that, okay, they haven't left the module. No one's gone and left me here in the room alone.
Hello, Ms. Stevens. Hi, I'm Dr. Norwood. I apologize for the wait. We're a little bit behind schedule, about 10 minutes. If you'll give me about 10 minutes, I should be able to come in with you.
Okay.
Okay?
Thank you.
You're welcome. Thank you.
So the nurse is going to come in. We're going to draw some blood work. We'll get all the tests. Everything should take about 2 hours altogether, just so you have an idea.
First of all, I try to change my demeanor a little bit when I finally go to talk about an operation or procedure we're going to do, so they understand that I'm seriously focusing on a topic that's important. I'll try to explain in layman's terms that they can simply understand. I would suggest that probably a little physical therapy will be helpful to you. They'll train you in the concept of movement, strength, recovery, and as soon as you have your full motion back and your strength, which probably will be another few weeks, you can get back to playing. How's your pain control? Is that all right?
It's really good, actually.
Good, good. So you don't need any more medications at the present time?
No, I don't think so.
At any time we're talking about stuff, you just stop me and ask questions. Okay, so the reason sometimes a C-section could happen when a woman is in labor, there's 3 things I need to have go well.
Once again, we want to explain to people what's going on so they have an understanding of what's going to happen. People are really nervous. They don't know what's going to happen. They don't want to be in the emergency room. They're worried. So if we can give them some idea of what's going on, the thought process in which I'm trying to accomplish things, what are some of the potential things that could be causing the problem, this helps us to ratchet down some of the fear, some of the nervousness.
I think it's also important from a patient standpoint that the patient feels that you care about them, that you're, compassionate towards them, and I think they'll be able to, accept even bad news, what you have to say. I thank you so much for coming in, and I hope that I've allayed some of your fears and answered your questions.
Yeah, thank you so much.
You're welcome, and it's so nice to meet both of you.
We do appreciate you, Dr. Robinson.
Of course, a big part of what I want to do here is give you some peace of mind so that when you leave here, you're feeling better about what's going on. We have a plan in place so that we know we can get you feeling better.
Sounds good to me.